And a debate is brewing over widely used antidepressants millions of Americans rely on. While speaking to federal health workers yesterday, Secretary of Health and Human Services Robert F. Kennedy Jr. said he will use the agency's resources to investigate the nation's problem with chronic diseases, pointing to some antidepressants as a potential cause.
We will convene representatives of all viewpoints to study the causes for the drastic rise in chronic disease. Some of the possible factors we will investigate were formerly taboo or insufficiently scrutinized. The childhood vaccine schedule, electromagnetic radiation, glyphosate, other pesticides, ultra-processed foods, artificial food additives, SSRI and other psychiatric drugs. Nothing is going to be off limits.
President Trump signed an executive order last week that called medications including SSRIs, mood stabilizers, and antipsychotic drugs a threat. Now, critics of the executive order say SSRIs save lives, but supporters of the move say the drugs are overprescribed and carry serious risks. I want to bring in psychiatrist Sasha Hamdani for more on this. Dr. Hamdani, thank you for joining us. First, I just want to get your quick reaction to what the administration is saying about SSRIs and other drugs like that.
So I get that people want reform because this is an intrinsically broken system. But when you look at the actual science behind it, linkages of SSRIs to violence or dangerous behavior, that's completely unfounded and not based in science.
Now, SSRIs are just one type of antidepressant medication. So what are they most commonly prescribed to treat? And what's your take on the pros and cons of using them?
Yeah, so SSRIs are, as you said, one type of medication. They're used to treat depression. They're used to treat anxiety spectrum disorders like OCD. They're used to treat other things like hormonal dips, like with PMDD and some symptoms of menopause. They're used to treat fibromyalgia. They are a tool that we use to treat these kind of mental illnesses. And they're extremely effective when used appropriately. They do need to be monitored carefully with the help of a trained mental health professional. But for some people who do need medication, they're incredibly successful in giving them stability back.
There was also this moment from RFK's Senate confirmation hearing when he falsely claimed that SSRIs are more addictive than heroin. I want to play that clip for you.
He said that folks that take antidepressants are like addicts. That I can provide that,
Oh,
Mr.
I think
Chair.
they should have the availability. Listen, I know people, including members of my family, who've had a much worse time getting off of SSRIs than they did than people have getting off of heroin. It's the withdrawal period is, I mean, and it's written on the label.
So, Dr. Hamdani, should patients be concerned about potential addiction to SSRIs? Is there any truth in what he's saying there? And what kind of side effects do people have to look out for if they stop taking these medications?
I mean, okay, so no. So first and foremost, to answer your question, there is no comparison between the withdrawal from SSRIs and the withdrawal from heroin. That is unfounded, completely unfounded. The withdrawal of SSRIs, it can be tricky. It can be annoying, but it's not going to kill you like a heroin overdose is going to do or heroin withdrawal is going to do. SSRIs, people don't crave SSRIs or seek them out for a high. Stopping suddenly can lead to discontinuation symptoms, dizziness, irritability. Sometimes you get like this tingling sensation, but it doesn't mean they're like heroin. You just need to be monitored and guided through this process so it's slow and thoughtful.
So what are some common misconceptions or stigmas about SSRIs that you feel like the general public needs to understand?
I think that's one. I mean, when you get this very confusing narrative that's being pushed out, people start to worry about, are they addictive? No, they're not. They're not addictive. You start to worry about, are they going to make me dangerous? There were some claims that SSRIs had some linkage to school shootings and things like that. SSRIs do not make you dangerous. In fact, you're far more likely to have issues with violence towards you if you're dealing with untreated mental illness than to have feelings of violence towards others. I'm very concerned about this in terms of access to care and in terms of stigmatization. We've worked so hard to get to this point where people feel comfortable trying to receive care.
All right, Dr. Sasha Hamdani, always great to have you on. Thank you.